we're going to be talking about COVID-19 and how it has impacted the mental state of everyone around us. Now, we all know that COVID-19 certainly caught us off guard. We've been stuck in a home under lockdown with family. For some people, it's been a blessing to be able to spend quality time with their children. Although I suspect the other side of the experience is that it's been a nightmare because some people have had to spend quality time with their children. And of course, people are having to spend abnormally long hours with their spouses, which could also lead to great stress and pandemonium in the house. I don't know, we're gonna find out a little bit more about that. And on a more serious note, you know, there's the anxiety that comes with what's going to happen next. Will I still have a job? Am I going to be able to keep my job? Will my profession even have any legs in the future? So if I'm in the restaurant business, you know, will people be coming to restaurants for the next 6 months, or are they going to do it all online or just come and get takeaways? So there's a lot of uncertainty, a lot of anxiety, a lot of concern, and I think that this is the best time for us to address it. And of course, the SciFest team have picked a panel full of complete experts in their fields. And it's not just the psychiatry and the psychology of it. We've also got the legal and the community people as well to find out what we need to know about COVID-19 and how it impacts on our mental state. So I would like to introduce our panelists very, very quickly, and then I'm going to give them each a chance to say a few words about themselves and tell us a little bit more about themselves and what they do. We have Meike Heybrecht, who is the Chief of Social Policy and of Child Protection at UNICEF. We have Prof. Nania Bowler-Miller, who is the Divisional Executive of the Developmental, Capable and Ethical State Research at the HSRC, and we will unpack some of those acronyms as we go on. We have Dr. Avivit Cherrington, the educational psychologist and chairperson of SSA's Community and Social Psychology Division. And we have Dr. Mbuyiso Talatala, psychiatrist and former president of the South African Society of Psychiatrists. So as you can see, this is by no means a wishy-washy discussion. We've got the big hitters with us. And if we are going to get into it, I think the best way to start would be to go to Dr. Mbuyiso Talatala. What I want to know, and I think we need to just establish, what do you define as mental health? Because we're talking about the mental health of people. Of course, physical health is going to be impacted because of a lack of exercise in the first part of lockdown. And then in the second part, only doing it at 6 to 9 in the morning. Not all of us get up that early. So there's definitely going to have an impact on the physical, but more importantly, the mental health. What is meant by mental health? And of course, what is this connection? What connection does it have to mental disorders and things like stress and anxiety and depression and loneliness? Over to you, but just maybe introduce yourself a little bit and then you can answer that question.
Thank you, Steve. I'm Dr. Mbuyiso Talatala. I'm a psychiatrist in private practice in Soweto, in a private hospital there at the moment. But previously, I was a president of the South African Society of Psychiatrists. I think that was 2014 to 2016. Just getting to your question, I would take the mental health to the definition of health by the World Health Organization, which says that it's not just the absence of disease. So is mental health. Mental health is not just the absence of mental illness. It is actually the presence of psychological well-being, mental well-being. It is how you feel about yourself, how you relate to other people, how you relate to opportunities, challenges of life. So overall, that's the technical definition sort of mental health. Now, when it becomes a disorder is when stresses of life affect your health to a level, to a mental health to a level where you either cannot cope at work or you cannot cope at home. So if there's any social or psychological or occupational distress in your life, then we call it a disorder. There are symptoms that we may have. I mean, you can all feel sad when something bad has happened. That does not equate to a mental disorder. It becomes a disorder if it really affects you, either at home or in your social space or at work.
Steve, we can't hear you.
About that, you know what happens when you like to mute yourself. Okay, so we'll come back to that. I want to move on to let's go to Dr. Avivit Charrington. What does community wellness mean, and how has this possibly changed due to the lockdown situation?
Okay, well, hello to everybody watching. So, like you said, I'm part of the Psychology Society of South Africa, chairperson of the Community and Social Psychology Division. So when we start talking about community wellness, we look at wellness on a collective level, and we look at the systems. So it's not just about each individual pursuing their own mental health, but it's really about pursuing a better life for all, and it's a connectedness of the community. So the more the community is measuring in terms of pursuing wellness and working together collectively towards that shared well-being, then we talk about community wellness. And so an individual can be thriving, but if he or she is in communities that are not, then that will negatively impact on the individual. So it's important to work on those multiple levels of the collective and the individual. And it's the same thing as the individual well-being, but just working on multiple layers and levels of that.
Okay. All right, we're going to move on to Prof. Nania Bola-Miller. Could you give me an overview of a survey that was conducted jointly by the University of Joburg's Center for Social Change and the Developmental, Capable and Ethical State Research Division of the Human Sciences Research Council? That is basically a mouthful, but of course this is an important survey, and what were the findings?
Well, I'm glad that you say it's an important survey. We believe it is too, mainly because it is representative of the general population. It's been weighted. And it's called the COVID-19 Democracy Survey. It was done through a platform, a data-free platform called Moya Messenger. We had 75,000 responses to the survey, but only 12,300 complete responses. So we only analyzed those 12,300, and it was from 13th of April to the 4th of May. So things have changed since then, but we're going to relaunch the survey on Saturday. And there were some really interesting findings. And I'd like to say that, I mean, this wasn't a clinical survey, so people self-identified how they feel in the survey. And 60% of South Africans are suffering from stress on average. And the second most cited emotion was fear, or feeling scared or apprehensive, and that was at 45%. 33% of South Africans said that under lockdown they felt depressed as well as irritable. Okay, so same percentage. Then 29% of South Africans stated that they felt lonely during the lockdown. 18% angry, that's climbing a little bit, unfortunately, and on average 12% happy. So there you can get an idea of what the most serious feelings are that people were expressing. And over time, what increased was stress. So from the beginning to the end of the survey, the level of stress increased by 3%, which is statistically relevant if you look at the population, the adult population. And loneliness was experienced an increase of 8%. And what's interesting is the young people are experiencing loneliness the most. We also found a difference between, well, we found some significance around gender and youth as well, if I can run through that quickly. So women registered as being more depressed than men by 4%, and more scared or apprehensive by 8% difference. But women were less lonely than men. Slightly less lonely, 3% a difference. And this is interesting, perhaps because women have this burden of care or pleasure, however you want to see it. And so they do feel less lonely, but they are far more stressed and apprehensive and depressed than men are. In terms of age, young adults are far more susceptible, that's 18 to 24 years old, to boredom, loneliness, anger, and irritability. And obviously, when we look at this evidence, we want to see targeted interventions. So we need to know where the problems are, right? And the determinant that really jumped out at us, which we weren't expecting, was hunger. So people who reported that they themselves were going to bed hungry, or people in their families were going to bed hungry, were 70%. 70% of them experienced stress versus 55% of people who said that they weren't experiencing any hunger. And also depression is something that experienced more by people who suffer from hunger. And hunger is a massive issue that arose during the lockdown and was cited as one of the things that was the most difficult to deal with, and that has a lot to do with income as well, and class and losing jobs.
Wow. I mean, that doesn't paint a very nice picture at all. And obviously, you know, in terms of the needs of an individual, if hunger is at the top of that list and you're not having that need met, that has so many ramifications for your mental state. Yeah, I'm sure we'll be able to unpack a bit of that. And if your mental state has deteriorated, that affects the protection of the children within your household. So Micah Heibrecht, you're going to be maybe chatting a little bit about the protection of children, because that is key to UNICEF. And what are some of the challenges associated with protecting children during COVID-19 lockdown?
Well, Steve, thank you so much for having me this afternoon, and really honored to meet everybody else. And thank you to the audience for following us this afternoon. So basically, as Prof has already indicated, we are looking at a total population in South Africa of 59 million persons, and 10 million people unemployed, 31 million people affected and trapped by poverty, and 11 million people going hungry. So if you look at well-being and wellness of children, this recipe of poverty, unemployment, and hunger really has led to higher levels of stress, but also violence and abuse of women and children, anxiety and fear. So what we are seeing is, in children, we are seeing symptoms of freeze, fight, and flight. As Prof indicated, is that a lot of people are demonstrating issues of anxiety, fear, distress, and that leads to children becoming, withdrawn, anxious. And when you are feeling anxious and fearful, you can't learn because you become paralyzed. So it is incredibly important that we look at the overall well-being of children in a family, and that parents try to manage their own distress in order to create a conducive environment for children to continue to learn and be living in a safe environment. But the Childline, we are working with Childline, and they reported in May alone up to 30,000 calls of children to 9 call centers with 86 counselors across the country, and stories about hunger and anxiety about the return to school, anxiety about poverty and the loss of livelihoods of the parents, and seeing their parents falling apart in front of their eyes. So definitely levels of fear, anxiety have deteriorated, which leads to substance abuse, loneliness, depression, but we also have unfortunately seen intensified cases of suicide. So definitely it's incredibly important for us to look at individual well-being, community connectedness, but that we interact and dialogue with the children in a very positive manner, create a pattern and a routine so that they get supported with a daily routine of learning, play, relaxation, watch a movie, read a book, do some exercise, have a good meal if possible, and then help them prepare with the return to school and accompany them in their journey. But please, to really avoid levels of stress of caregivers to be vouched on children, because it definitely impacts them directly.
Okay. So Mvuyiso, I'd like to know, should we be screening for mental state when we do COVID testing? Because, you know, if we have people coming in and they are presenting that they are in depression or having major issues, and we are screening them for just the illness, is there a way to even deal with helping out this person from a psychological point of view?
Thanks, Steve, for that question. I'm even scared to answer the question, because ideally we should be screening. Ideally we should be having interventions to deal with mental illness even before it starts. I mean, to deal with the precursors of it rather than dealing with the illness. Prevention is always better than cure. But unfortunately, as a country, we have not been able to screen for mental illness even before we had this crisis. So now that we've got this crisis, I think it's going to prove very difficult to screen, and once you've screened, what to do about once you picked up the problem. I know I'm not saying good news. I'm actually telling you the bad side of it. But the mental health care system is still going to experience severe stress, and it's not going to be able to cope. My view is that we're going to struggle to cope with with people with established mental illnesses. Screening would be ideal, but it's going to be challenging to do it. I don't know if you have seen, you know, in my hospital, I've seen even in private sector, so you see long queues going to Ampath and to Lancet for the testing. So the numbers are actually quite huge for the health system. I doubt we'll be able to cope. The short answer is we should be screening and we should be intervening, but I doubt if we've got capacity to do so.
I mean, I can imagine that's tricky. And Avivit, if one had to stop and think about the impact of COVID-19, yes, it is impacting the community, but there are two people or two groupings that I think are quite important. One are your kids, because they are missing out on learning, and you can't just take 6 months of learning out from a child. And because of various economical factors, there are some people who are being deprived of an education just because they don't have data, they don't have money for data, they don't have access to a device. So already they are missing out on that. But the seniors are the ones who are panicking the most, because they're the ones who've been told, you are the most likely to be hit by this and you cannot leave your house. So now they're stuck. There are seniors' homes that are in lockdown. They cannot even leave their rooms within the homes. And I know some personally who are experiencing this. What is your take on what's going to be happening over the next 6 months?
Okay, so I think that the important thing, is to just piggyback on what was said before. Screening implies that we don't know if someone is affected. And so that's kind of moot here, because we know everybody's infected. There's not a single person in this country that's not affected by well-being at the moment. You know, we're all just affected in a different way. So it's kind of pointless to screen people because we know everybody's affected in a negative way. So I think we need to be proactive in saying that we know this is happening. What can we do at different levels to assist people with coping? You know, and this is where we're seeing the vulnerabilities of our lack of communities in our society. The people who are the most vulnerable are vulnerable because they don't belong in a community, because they've been isolated. And when they need the support systems the most, they don't have them, right? So again, it's about not looking at the individuals, but looking at why are those groupings of people not being cared for in a collective way. And I think that our socioeconomic differences in this country have been placed front and center with this pandemic, in that we're seeing it so clearly now. You know, it was always there and we could turn a blind eye. We can't do that anymore. And the most vulnerable in our societies are the most vulnerable that were there before. So coming back to your question in terms of the two groupings, the kids and the learning and the senior citizens, it's kind of the same thing in a way, because now there's a whole other conversation, but I would argue that our kids were even learning before. I don't think our schools were teaching, and I don't think our kids were learning. So I think it's pointless trying to make up a curriculum that was never actually a quality education anyway, right? So, but that's a different thing. But the kids that are not accessing this education and are not learning, we're not accessing textbooks, we're not having toilets. I mean, these were things they didn't have before. So now that we are so concerned that children don't have data to go online, well, they don't have toilets either, and they don't have running water. And so, you know what I mean? It's kind of, I think we're kind of aiming in a place where it's showing us this massive issue of community. You know, where have we not built community? Why are elderly people sitting on their own in places of care? Where are the families? Where are the neighbors? You know, it's that kind of a thing. And actually, if you look in some of our rural areas, which still had a very good sense of cultural connection, the vulnerable are not the elderly. The vulnerable are the people who are working class because they had to go and work. Those who were the senior citizens were very well looked after because other people went and got food for them and other people did things. And so the fact that we've had decades now of losing a generation of adults that are caring for senior citizens, you know, I think that is where we need to look at. If we're looking at intervention programs, if we want to heal, then we mustn't only look at the physical healing. We must heal our society in terms of connecting again, you know. And so if that
Absolutely. But now you know what happens. You get stuck in lockdown, and the first 3 weeks you are baking banana loaves, you are doing what you can to cope. Things are going well. You've even got a vegetable patch, and you've got a third of a carrot growing, and you feel that life is wonderful. But then lockdown gets stretched a little bit longer and tensions start mounting. And then, of course, the government says, you know what, certain industries, I'm afraid you can't go back. And now you're thinking, well, I don't have any employment. I can't work anywhere. I have to get my job. What is going on? And then all of a sudden, the government says, no, I'm afraid you are going to have to stay in lockdown number 4. And people decide, that's it. They can't tell me what to do. I'm taking you to court. So Prof. Nania, there was a very famous court case. Maybe you want to tell us about it.
There have been numerous court cases, and some of them have been won and some of them have been lost, but not many of them have been seen in the media because they were relatively small issues. But the big case was the De Beer case, and the Judge Davis had to look at some of the regulations. So just to make it clear that there hasn't been a challenge to the actual lockdown. There's been some political rumblings now around the Disaster Management Act. But as far as most people are concerned, what happened was what needed to be done, and it was an international trend, and the World Health Organization encouraged this. But what happened as we went along, as you say, and we started opening up little by little, we started having these regulations that were issued by ministers according to the Act. And some of these regulations just didn't make sense to people. And so this did go to court, and the judge unfortunately wasn't very objective in his judgment, and he wasn't applying legal principles consistently. So what you need to do when you look at a regulation is you need to ask, is it fit for purpose? What is the rationale for this? And why is government doing it? And does it have a certain purpose in this particular situation? And you also look at proportionality. So you say, well, you know, this will cause very little damage or harm, whereas something else would cause more damage or harm. But anyway, he mixed up all his principles, and so it's been appealed by the state. I'm still waiting for the outcome of that. And there are some regulations that will probably be declared unconstitutional. I'm not sure though, because some of them were small issues, merely irritants, such as not being able to buy sandals. And there were a lot more serious issues that people are facing in the country, such as this devastating inequality and issues of hunger. So we'll have to see. We have another case where we're awaiting the outcome, the whole issue of tobacco. And I don't know why the court's taking its time with this one, because it recognized it as an urgent matter, but we still don't have an outcome. So it is a very complicated and complex matter, but it also has well-being and mental health issues, whether people like it or not. But I really don't think that running to court is going to resolve these issues. We need to look at it in a more systemic way. And work together as a community. So the survey, for example, we did see a level of social solidarity coming through across class and race, in terms of everybody being worried about the economy, and everybody being concerned about the virus, and more than 70% of people supporting lockdown throughout that period. And more than 80% of people placing their trust in the president. And I know that that's changed, and we're interested to see in our survey how much that's changed. So there are other issues, and I think the law can be quite divisive. So it would be better to try and resolve some of these issues without going to the courts, and rather just talking through what people perceive as is necessary or not necessary, rational or not rational. But we're still waiting for the outcome of the appeal there.
Okay. Well, I mean, I'm getting some interesting questions coming through, and notice some of them are anonymous because they don't want to associate their name with the question. You can imagine the anxiety of maybe someone labeling them as someone who asked that question. But these are important questions nevertheless. And the first question was how to support depressed post-grad students due to COVID-19 that left them with no means of financial assistance, especially if they are also the breadwinners at home, and considering the fact that they do not qualify for the unemployment fund. So who would like to tackle that one? Any takers?
I'll give it a go.
Okay.
Yeah, Anonymous, I get you. I think we're all in a situation where we've had to let go of certain things and unknowing. And I don't know that there is support other than your own shift your mindset. You know, I mean, when I read your question, like, oh my God, it's a postgrad, which means you've survived years and years of studies. You've been through hell and back. You've managed to get support for that. You've had people around you. You're also a breadwinner, so you have a family, so you have a home. You know, there are many things you don't have, but let's start counting the things you do have and start looking at the assets that you have around you. You know, you are an asset to other people. So perhaps, you know, as hard as it is to put your current studies on hold, the world's not going anywhere. Graduation is not going to happen without you. So, you know, I think the idea of people trying to kind of take back 3 months and start again is where people get stuck, where it is about looking at, right, that is not gonna, it's not gonna leave, it's not gonna go away, it's just on pause for now, and use this time. You know, I don't know what your studies are about, and I get the uncertainty of the finances and the family, but use this time to grow and learn, rather than feeling helpless, and start looking at what you can contribute, rather than what you're lacking. And perhaps that's not going to solve your problem, but it will change your mind view.
Okay. If I may add, Steve, Anonymous must also just, you know, communication goes a long way. He or she must share her fears or his fears and anxieties with the family, with the university. We are all at a time where we are losing something. We are all at a time where we're gonna go through some grief, some loss. So it is better if we actually approach the loss or the losses as a group, as a community, as families, as communities, and as a country, rather than her facing these challenges alone.
Okay, I mean, let me play devil's advocate. So you share your loss, you share the fact that you're unemployed, but you're still not putting bread on the table. You're still not eating. And sharing the loss is not going to address the fact that you're still hungry. And there's nothing you can do about it. And that feeling of helplessness can be overwhelming.
But so the sharing helps. Actually, sometimes during difficult times, as Aviti has mentioned it, we miss some of the resources that we have. There is some level of resilience that we actually have. So when you share with families or we share with others, the others can pick up the resilience that we're actually missing because of the cloud of depression around us, or the fear that, when you are in the storm of fear, you may miss some of the qualities or even resources that we have at your disposal. We are all going to come out of this pandemic using the resources that we have, even if we lose some.
Mm-hmm. So it's about managing expectations. It's about saying to yourself, look, it's not all going to be roses when we come out of this. We're going to be dusting ourselves off, some of us a little bit more than others, but we will see the other side. It's just, you just have to hold thumbs that it's going to work out in your favor. But it's complicated. It's not a simple case of, just manage your expectations and deal with what you have and be appreciative of what you have, because some people are in that deep pit and all they see is darkness around them. So whatever advice you're throwing down, you're saying, don't worry, it's all going to be fine. You'll get to the top. They're looking up going, but it's so deep. How am I going to get there? So it can be quite overwhelming, but we are going to come back to that. I just want to quickly put a question to Micah. Oh, yes, Micah.
So I think what Dr. Vivid said and Dr. Talalata is important because what we have seen is a tremendous amount of solidarity as per a social compact. And a young person can engage its community to mobilize. And all of us have to contribute to living differently and distribute wealth across. And I think that the amount of examples of solidarity at community level has been tremendous. And young people can become engaged in those community initiatives, which is also mobilizing support in kind or cash to complement the state. We can't always overburden the state by, in a handout way, but become positively engage yourself to address some of these problems by mobilizing, and by doing so also sharing your stories and the burden of care.
Well, I want to just throw one extra question at you since you were mentioning that. The number of learners that are taking part this year at school, many of them are way behind purely because no learning was taking place. And I know that some teachers, some of the panelists have certain feelings about the curriculum and whether learning was taking place at all, even when they were at school. But here's the thing. They are at home, no learning is taking place because no content was being brought to them. They had no access to classes and teaching online. So literally for the last 100 days, no learning was taking place. What I want to know is, do you think that with the inability to finish the year, is there even a point in trying to finish the year? Or should we just, are they going to be able to catch up by the end of the year if we're only going to go back in 2 or 3 months' time? Because the way it's been staggered, still, there are lots of learners who are not learning. And the digital divide between the haves and the have-nots is so wide that of all the years, ironically, 2020 is the year where we have 2020 vision, and we are actually seeing it like we've never seen it before. So do you think that these kids should even be trying to finish school this year? Or do you think, we should just keep fighting on until we get to the end of the year?
Well, I think there have been different modalities for the learning to continue. Some were through radio programs and through TV programs, and some through, other means that came to children, even through WhatsApp messaging, explaining the caregiver how to engage with the children. But I agree with you, Steve, that the backlog has accumulated tremendously. And I think what we are discussing this afternoon is not to augment any stress on children and their levels of anxiety. And if it is becoming further imposed that we have to finish and have to catch up and have to deliver at the end of the school year, I think at this moment we need to manage well-being and stress levels and fear of children. So I can't say if we should or shouldn't. What I can say is that for the grade 7 and 12 learners, it will be important to accompany them in their return to school and manage their fear and their new normal, and work with the teachers to create routines in a child's life that allow them to be protected from COVID, the social distancing, the wearing of a mask, so that their stress levels are being managed in such a way to create a conducive environment for them to absorb anything new. Otherwise, it's just managing stress and a new context. Normally, it takes children 4 to 6 weeks to settle into a new environment. So that will be important, but also to allow children to learn how to manage stress, daily routines, breathing exercises, a song, in order to at least decrease these levels of anxiety and fear and stress, in order to allow some kind of learning. In terms of the catch-up and what has to be delivered this year, I leave it to others to address, but my main concern would be don't impose any further stress on the children than that what they are experiencing now, and make the return to school as safe and as conducive as possible.
Okay. One of the attendees sent an anonymous question. They said sometimes it's difficult to identify if, let me get to the gist of the question. It was like, in a town like Makanda, as an example, getting mental health care is seen as a luxury. So now, in a state where you don't have any finances, but from a mental state, you are collapsing, and now you need to get mental assistance or a doctor to see you, but you can't afford to see the doctor. What are your options? Because if you keep it in, it's just going to make things worse. And some parents are trying their best to put on a brave face for their children, because they don't want their children to be anxious that they don't have any money, that they don't know where the next meal is going to come from. But the reality is that that's what they are facing. So how are they going to get medical assistance if they can't afford it?
Steve, there are available government services. I know they're not the most ideal. There are available government services. Even in Makanda, you can go to the clinic. You should be able to be assisted. There should be some kind of level of government services. The mental health services are not ideal, even in private sector, where people are paying. It's not like if you want to see a therapist, you'll get one tomorrow. You may still have to make an appointment. If you are going to a public clinic, you may still have to wait in a queue. But I think if you feel, if a person is feeling that they are in distress, they are not well, they should approach a public clinic if they don't have money.
Mm-hmm. Well, just going, you wanted to say something, Nadia?
Yeah, please, Steve. We had some open-ended questions in our survey, and one of the things that did come out, and something that the question addresses, is the stigma. So if you're feeling stressed, anxious, going through withdrawals, and all those kinds of things, it's seen to be almost indulgent to say so, because you still have a roof over your head, or you may still have your job. And I think that kind of stigma should also be removed. And we should reconsider the way that we talk about well-being and mental health. Because otherwise people are just going to keep quiet, because they don't want to let other people know that they're suffering and they're struggling. And so it's very difficult, I know, to talk about this when we do live in a country that is so unequal. But simultaneously, I don't think that people should feel stigmatized about these kinds of things, and they need to be able to seek help. And I think there are a number of call centers, and they're on the government websites that take calls for free, as well as the WhatsApp number. So there are options to speak to people, and I don't think that there should be any fear of saying that you're not coping, because I could probably say that almost all of us are not coping, but in different ways.
Maybe what could happen is, if you have any hotlines that people can call, if you can send us the numbers, SciFest will put them up on their social media pages so that people can at least access those numbers that you were referring to. We're getting a lot of interesting questions, and I'm going to pick and choose one or two in different orders so that I can come back to it. Someone said that, okay, it was Monique. She wanted to know, what effect does this pandemic have on old trauma? So let's pretend you are already in a state of trauma, or in a vulnerable state, and then you get put into lockdown. How does that impact on your old trauma with all these new, fresh things that you have to face as well? Maybe Dr. Tala, would you like to chat about that?
That's fine. Steve, I didn't want to appear like I'm talking a lot, but the question does apply to my area. You know, old unresolved trauma is likely to come back to a person, or to be revived, if I use that loose term, when they're experiencing new trauma. Even if the two traumas are not exactly the same. I mean, the trauma that we are going through of this pandemic, plus the lockdown that is associated with it, may not be exactly, most of us haven't experienced that in South Africa. But once it may be a different trauma, it's likely to revive the old unresolved trauma. And I think if there's any unresolved issue, or if there is any kind of mental illness, especially with mental illness, this is the time to consult. That is why we can't close our offices as therapists at this time. This is the time we should be offering more support to people who are living with some kind of mental illness.
Okay, I'm going to come back to you because I've got some interesting questions to throw at you again. But one of the questions was that, you know, we have a situation where young kids are being thrown in a situation where the circumstances, they're not allowed to see their friends, they can't go to school, their whole world around them that they know has now crumbled down, and a lot of them don't actually understand what COVID-19 is all about and why it's picking on them in particular. What is the best way to explain all of this to young people? So I'm going to throw that at Micah, because I reckon that you're working with the kids. Maybe you want to tell us, what is the best way to get this whole COVID-19 thing to people, to young people in particular?
So, as I said before, this has really led to a situation where children demonstrate fright, fight, and freeze, which is that they basically withdraw after such long time of social isolation. And it is very important to listen to children's stories, as the Dr. Tala was just saying. It is very important for young people to tell their stories and be listened to, and create an environment where you can dialogue between each other. That's the most important. And then to talk openly about your feelings and what you experience, and then organize games, movies, recreation, exercise to relieve the stress. It's very important to give children tools to be distracted from the worry and the concern. Singing a song, do a play together. A lot of parents are encouraged to enhance that quality dialogue and interaction. Cook a meal together, do a song together, do a game together. This is very important to allow children to express their emotions and for people to engage. Young people will have need to connect with one another. So social media is important for that. Let them connect through WhatsApp chat groups with each other to make sure they don't feel that social isolation so physically, but that they're still in the life space of each other. connect closely with family. It's important. Everybody is in the same position in that sense of feeling socially isolated and fearful. It's a new unknown. We don't know how long it's going to last. We are not completely able to oversee the impact economically, socially, or qua education. So it's very important to stimulate young people to become engaged and to stay involved with one another.
Okay, now one of the things that is a reality with COVID-19 is obviously we have many people who are getting sick, but we also have many people dying. And we haven't seen these sorts of statistics in since I've been around. So this is quite a shocking situation for many people. And one of the questions was, you know, are we becoming desensitized to the fact that there are so many people dying, but they're not really out, we don't really know them, there are other people, they don't connect to us? Or is it a case of it's affecting everyone and it's even happening in the families that are close to us? And are we more focused on trying to get food on our table, trying to get work done from home, than worrying about the number of people who are actually dying in South Africa? Is it just a number to us? So maybe Abhavit, that's something you want to look at, because that's a community thing. I mean, are we as a community becoming desensitized?
I think that there's layers on this, again, because of the socioeconomic gap in this country. For many people, this is not shocking. For many people in the country, for years, Saturday has been a funeral day every single week, right? For 52 weeks of the year, you're going to a funeral on a Saturday. We all know that HIV decimated our society, but for a certain percentage of the country, this is the first time they're seeing these kind of numbers. But this is not for everybody in the country, right? So, and I think that the idea here is that it's very easy as South Africans to kind of separate and say, well, it's happening to them, not to us. And the them and the us can separate across various lines, you know? And it's the solidarity now of saying, well, we're all impacted sort of equally in terms of health. We're all vulnerable and that sort of thing. I don't know that we're getting sensitized, because I think it's also different in different parts of the country, where certain provinces kind of hit a peak and are slowing down. Others are only picking up now. Just in my work and colleagues and city, then we're starting to know more people who know people who've lost people, you know, and I think it comes to hit home a lot harder than it did maybe. You know, we were watching TV, we saw it overseas, but now all of a sudden you start to hear people that you actually know, you know, that have lost loved ones and so forth. So I don't think we've reached desensitization yet. I think we're still at a stage where it's not quite real. But again, to some of us, this is you know, and this is where the different types of communities and settlements and communities in this country differ so greatly. Because, you know, I remember in the beginning of lockdown, and, you know, everybody sitting in the suburbs is going, look at the townships. Why is nobody taking this seriously? Why aren't they isolating? And it's like, seriously, like, do you even understand the realities of living in that environment? You know what I mean? And it was just this complete denial of what more than 70% of this country are the living conditions, you know. And for some people, they weren't scared of COVID. I mean, there's 100 other things you're more likely to get before you're even going to get COVID. So it was a non-issue, you know. So I think for people who have been living with that kind of fear, this is a different kind of fear. I think it's more of the economic situation that's hitting harder than the actual fear of the virus, in terms of the COVID virus. Whereas for another sector of the society, it's the first time we're experiencing this. So mixed kind of.
Okay, and you want to say something? Yes?
Yeah, I might have something that's slightly different, actually, and an outcome of the survey that was very interesting. And we asked people if they were willing to sacrifice some of their human rights in order to save others. And it was a high percentage, 66% on average, of South Africans. And interestingly, Black poor communities were more willing to sacrifice human rights than any other community. And that is remarkable. And it might be a result of the fact that human rights haven't really even been felt in those kinds of circumstances, and yet they supported the lockdown. So these kinds of dynamics are not always easy to understand. And we do need to take that context into consideration. But I mean, if 66% of South Africans are willing to sacrifice some human rights to save others, there's a relatively high level of social solidarity there.
Okay, I want to just kind of bring a little bit of focus in and try not to be too morbid, but the fact is people are dying. So in our circumstances, when someone dies, you'd want to go to the funeral, but there were restrictions on who could go to their funeral. So some people were not even able to go and see their partner, their spouse, their parent when they were dying because they were in isolation from each other. And of course, that has its own implications as well. So maybe Dr. Talatala, would you like to let us know a little bit about how do we address our families when we are dealing with, or how do we cope with grief in these difficult times?
Yes, Steve, this virus is actually quite difficult and different from what we've experienced before. Firstly, although it's not killing a lot of people, the rate of death is about 2% of the people who test. So it's not that high compared to other diseases or other problems we've had in the past. But if you had to compare it with HIV took more than a decade to really start killing South Africans in huge numbers. This has taken a few months. We're already, in fact, I would say even weeks, we're already having people dying. That's the first part. Then the second difficult part with this virus is how it has interfered with the ways, the rituals or cultural practices or religious or spiritual ways of coping with losses, especially death. People can't go to funerals, those who usually go to funerals. I mean, with Black families, people spend the whole week sharing the grief. Before the funeral, there's rituals around the funeral. There's rituals even after the funeral. I mean, you can't even have the church properly there to support the family. So in terms of coping with the loss, dealing with this grief, I anticipate that we're actually gonna see, even though the numbers may not be huge, we're actually gonna see a lot of people going into severe depression because of the losses and the unavailability of the established coping ways. The other thing is that although I'm saying that it's a small number of people who die, but it's only a small number if you look at the entire population from 1 to 100 in terms of age. But if you are in the vulnerable group, hypertension, diabetes, obesity, or if you are older, then it's not really that low. Then you start seeing a lot of people in those vulnerable groups passing away. So people are actually going to experience death, especially those who are in those vulnerable communities or groups of the population. So I think the lack of, the fact that the lockdown and the way that we've legislated around funerals has minimized the community support. We are actually going to see a lot of people suffering. I would actually suggest to anyone who's experienced a loss to actually consult earlier than later.
Okay, but now I want to try and bring it all in because we've only got a few minutes left and I've still got lots of questions I want to ask. So now we know we're in the situation. We know it's tough. We know everyone is struggling. We know that it's impacting on us from a psychological point of view. What are the coping mechanisms or methods that we could use to improve our situation from a mental point of view, a mental state point of view? So maybe each of you might have some strategies that you could suggest from a legal point of view. Are there any things that we would need to know from a community point of view, from a medical point of view? I mean, are there things that we should know that would help us to get through COVID-19 a little bit better so that we all make it through to the other side? So who would like to start first? Don't be shy.
Maybe because mine is not from a clinical point of view, I'll start and then leave it to the experts. I think that we can be grateful in South Africa that we still have a functional democracy. Even though people feel that the state has been paternalistic in certain instances, it's had to be. But Parliament is functioning now, and Parliament is overseeing the executive as it should in a healthy democracy. The courts are operating, people are going to courts, they're challenging the state. So we still live in a vibrant democracy in South Africa. And that is something that we can really rely on and may make us feel a little bit better about our circumstances, even though they feel so bad, that we have this kind of environment that is human rights based and democracy based, and that the state has made mistakes, but also created awareness around the mental health issue.
Okay. Maike, would you like to say something to that?
Yes, definitely. Thank you so much. So, you know, Dr. Vivid was mapping before, how, you know, the structure of your family, the structure of the community, and map what you do have. And I think it is important to express gratitude of what there is and to amplify grace in these moments, to demonstrate what is there and appreciate it. I mentioned before the importance of a daily routine. It's very important to agree with the family what you're going to do today, how you're going to do it, what you will do together, how to prepare and when prepare a meal, preferably diversified with some vitamins, because we need to boost the immune system where possible. There is access to food in South Africa. For that we can be grateful. Other countries might cope much worse than South Africa does. Here there are some safety nets and there is still food supply and a market that works. It's very important to keep fit, especially, you know, that gives you endorphins, and keep exercising to stay fit during this time in order to make it to the other side. And express kindness and care to self, first of all, and then to others with whom you live in your direct environment, but also express concern to those that are grieving, to those that are going through hard times. And share. Sharing is caring, you would say to a toddler, but basically that is very applicable right now, that we all share and care for one another. And I think that is coming to the fore in South African society, and that's very beautiful to praise and to embrace.
And Dr. Tala, if you were going to give any advice for how people should be coping, should they be able to order medication online? Should they even need a consultation? How are they going to deal with the mental anguish and the anxiety?
I think everyone must listen to their bodies and listen to their and observe their mental health and consult. If I to advise, we must consult early. I would encourage family support, interacting with family and family support. One last thing, if you are working from home, it's also, that is still difficult. So you have to create your own routine from working from home, have your separate workspace. The family must be aware what time is work time, what time is after work. And make sure that to the employers now, you do not, because people are working from home, it doesn't mean that they must have meetings at 8 o'clock or at 10 o'clock at the times they would not have had time, meetings.
Okay. And Avivit?
I guess I would say that, you know, while we're all struggling with the economy and there's a lot of stress in terms of our basic needs, what South Africa's always had is human capital and social capital, and we need to rely more on that. So look at the strengths that we do have, and that will get us through. So for instance, like the first question we had, you know, everybody's got something to offer. We need to reach out, social distance, but we need to reach out with kindness and generosity, because everybody's struggling in some way. And you have a lot to offer other people just as they can offer you. And so we need to kind of get past this old way of doing and being and start to really think about ourselves as part of a bigger picture, part of a collective that is going through this experience together. And the only way to get through your anxiety and your depression and your fear is to know that you're not alone, and to reach out to other people, because by trying to contribute, by trying to be part of something, and it's little things that you can do, you know, it doesn't have to be big things. You know, you have an education, you could tutor children. While you're tutoring the children, some moms might have an extra hour or two and they could make an extra meal for your family. While you go jogging, ask the old lady if she could take her dog for a walk. You know, reach out to people and do what you can, and together you'll find that it does get you through the worst of it.
Sure. Well, I know that I can spend another hour asking questions, and we didn't even touch on, you know, the impact that alcohol has had or has not had on communities. You know, some people would use alcohol as a coping mechanism, and now they are deprived of it, and then all of a sudden they opened the floodgates, and when that came in, that obviously led to a whole bunch of other issues with gender-based violence and stuff. But I mean, yeah, they've only given us an hour. They should have given us at least 3. What I do want to say is, before we thank our panelists, this is going to be the last webinar for this month, and SciFest will resume in the week of the 13th of July. Of course, they're now going to be focusing their efforts on the virtual National Arts Festival. So if you have not visited the National Arts Festival website, please do so. You can follow their Twitter at GHT SciFest, Facebook at SciFest Africa, and of course you can subscribe to the YouTube channel to watch all the live events. We've been given some numbers like Childline, 08 000 55 555, and we will put some more of those numbers up that have been passed on to us. We'll put those up on social media. I would like to thank our panelists. I know that we only just touched the surface of the issues, because in reality it is far more complex than just, you know, meditate and you'll be fine, or don't worry, be positive, and you'll see the silver lining on the other side while you are unemployed and your spouse and you are not getting on, and your kids are struggling with school and you don't have any employment, and all those things happening. And while that's happening, the bank still feels that it's appropriate to keep taking debit orders off your account, and you're worried about the fact that if there's not enough money, what's going to happen? Will I get a bad credit record? Am I a bad person? You know, there's just so many things that people are anxious about. I am of the opinion, and maybe it's just me, and Dr. Talatala can confirm this or refute it, but I'm of the opinion that a positive mind can go a long way. And someone said to me last week, you know, how do you feel about the fact that your entire business, teaching in classrooms, is now out of the picture for the next 6 months? How are you going to earn your money? What are you going to do? And I smiled at him and I said, I'm excited about the challenge. And that might seem unrealistic, but the reality is that if you do have a certain mindset where you don't see a situation like this as a dead end, but you see it as an obstacle, then I find that it's much easier to cope when you are creative and you look for innovative ways of solving problems. But that is the line of business that I'm in, so that's why I probably enjoy it. But not everyone is at that mental state where they can quite comfortably say, you know what? I have a roof over my head, I have food in my stomach, I should be very lucky. Because maybe it's only 1 tin of baked beans for a whole family of 6. So it's all relative. Every person says they have a roof, but what kind of roof are they talking about? Every person says that I have a home. What kind of home are they talking about? Every person says I have a family, but what kind of family members do you have? Are they abusive? Are they not abusive? So it's every single person has their own unique situation. And I do think that I'm hopeful for everyone that we will reach the end of the tunnel, and most of us are going to be able to get out there, dust ourselves off and say, we managed to do it. But I'm also hoping that from a human point of view, we're going to be dragging a few of those people with us, because it's not fair to leave everyone behind and just only look after yourself. We've got to try and share the spirit of Ubuntu and try and be the best people that we can be and help as many people as possible. And of course, with our panelists over here sharing their insights and their thoughts on how best to cope with COVID-19. On that note, we wish you all the message of staying safe, social distance, and remember, we're about to go into the peak now. So this is the time where you should not be complacent. This is the time where it's going to make most of the difference if you actually adhere to all the rules and regulations. And on that note, we would like to bid you all farewell. And thank you so much to all the people who are watching it live on Facebook and on YouTube. And of course, the people that joined us, all the panelists as well. Hopefully we managed to address most of the questions. So thank you very much. We're going to say goodbye to everyone. Bye-bye.
Thank you.
Bye. Thank you for having me.